You're lying in bed next to your partner, and something that used to happen automatically is not happening tonight. The desire is there, the attraction has not diminished. You want this to work the way it used to work, the way it worked reliably for decades without requiring thought or effort. But your body is not responding the way it once did. The firmness that used to arrive unbidden now arrives inconsistently, if it arrives at all. You're not sure when this started becoming a pattern. A year ago? 2 years ago? The change crept up so gradually that you cannot pinpoint its beginning. You only know that something has shifted, something that affects not just your physical function, but your confidence, your relationship, your sense of yourself as a man. You have probably assumed, like most men your age, that this is primarily about hormones, testosterone declining, the natural consequence of getting older. Perhaps you have even had your levels tested, received reassurance that they are within normal range, and wondered why the reassurance did not translate into improvement. The number looked acceptable on paper, but your body still was not performing the way you wanted it to perform. What if the explanation is not primarily hormonal at all? What if the mechanism you assumed was failing is actually functioning adequately, while a different system, one you rarely think about in this context, has become the limiting factor? What if the key to restoring what you have lost lies not in hormone clinics or pharmaceutical interventions, but in something as simple as what you put on your plate? This is about circulation, about blood flow, about the vessels that must expand and fill and maintain pressure for your body to do what it is supposed to do. And it is about one particular food, humble and inexpensive and widely available, that has demonstrated remarkable ability to support exactly the vascular function that male sexual health requires. Not as a stimulant or an aphrodisiac, but as genuine physiological support that addresses the root of what is actually going wrong. Let me explain what is happening in your body as you age, why the conventional understanding misses the mark, and how something as simple as a vegetable can make a meaningful difference in a domain where men often feel they have few options beyond accepting decline. The penis is not a muscle. This seems obvious when stated directly, but many men think about erections as if muscular effort or willpower were involved. They believe that wanting it enough should make it happen. They experience failure as a failure of desire or determination. But the mechanism is entirely different. The penis is fundamentally a vascular organ. Its ability to achieve and maintain firmness depends entirely on blood vessels doing their job correctly. When arousal occurs, signals from the brain travel through nerves to the penile tissue. These signals trigger the release of nitric oxide, a molecule that causes the smooth muscle in blood vessel walls to relax. When these muscles relax, the vessels dilate, allowing more blood to flow in. The specialized tissue of the penis fills with blood, expands, and becomes firm. Valves compress to prevent the blood from draining out prematurely. The erection is maintained as long as the vascular system continues performing this function. Every step in this process depends on healthy blood vessels. The arteries must be flexible enough to dilate properly. The inner lining of the vessels, the endothelium, must produce adequate nitric oxide in response to signals. The smooth muscle must respond to that nitric oxide by relaxing. The overall circulation must be robust enough to deliver sufficient blood volume. The veins must function well enough to maintain the blood where it needs to stay. Aging affects each of these steps. Arteries stiffen over time, becoming less responsive to dilation signals. The endothelium loses some of its ability to produce nitric oxide. Inflammation accumulates in vessel walls, impairing their function. Atherosclerosis, the buildup of plaque in arteries, reduces the effective diameter of blood vessels. The cardiovascular changes that increase heart disease risk also impair the small vessels that serve the penis. The penis actually provides an early warning system for cardiovascular health precisely because its vessels are smaller than those serving the heart. Problems that will eventually manifest as heart disease often show up first as erectile difficulty. The same vascular dysfunction that will one day threaten your heart is already affecting your erections today. This is not coincidence, but consequence. The same system is failing in both places, showing up first where the vessels are most vulnerable. This vascular perspective explains why testosterone replacement often disappoints men, hoping it will restore their function. If the problem is hormonal, adding hormones helps. But if the problem is that blood vessels no longer expand properly, if the endothelium no longer produces adequate nitric oxide, if circulation has declined to the point where adequate blood simply cannot arrive where it needs to go, then hormones cannot solve what hormones did not cause. The signal may be present, but the vessels cannot respond. This perspective also explains why pharmaceutical interventions, the medications designed to assist with erectile function, become less effective as men age. These medications work by enhancing the nitric oxide pathway, by helping the body use whatever nitric oxide it produces more effectively. But if the underlying capacity for nitric oxide production has declined severely, if the vessels themselves are too stiff and damaged to respond, there is less for the medication to work with. The medication amplifies a signal, but if the signal is too weak, amplification has limits. The implication is clear. If you want to address erectile function in a way that goes beyond masking symptoms, you need to address the vascular health that underlies function. You need to restore the capacity for nitric oxide production. You need to support the flexibility and responsiveness of blood vessels. You need to reduce the inflammation and oxidative stress that damage vascular tissue. This is not a quick fix. This is rebuilding the infrastructure that makes function possible. Nutrition offers a powerful tool for this rebuilding. What you eat affects your blood vessels directly and profoundly. Certain foods damage vascular tissue, promoting inflammation and stiffness. Other foods support vascular health, enhancing flexibility and function. The cumulative effect of dietary choices over months and years shapes the vascular environment in which sexual function must occur. One food stands out in the research for its ability to support the specific aspects of vascular health that male sexual function requires. It is not exotic or expensive. It has been cultivated for thousands of years. It appears in cuisines around the world, and its effects on nitric oxide production and blood vessel function have been documented in numerous studies. The food is beetroot. Beetroot is exceptionally rich in dietary nitrates, compounds that your body converts into the nitric oxide that blood vessels require to relax and dilate. This conversion occurs through a fascinating pathway that depends on bacteria in your mouth and stomach. You consume the nitrates in beetroot. Bacteria on your tongue convert some of these nitrates into nitrites. The nitrites travel to your stomach and bloodstream, where they are further converted into nitric oxide and related compounds. This nitric oxide then acts on blood vessel walls throughout your body, including the small vessels that serve the penis. What makes this pathway particularly valuable for older men is that it bypasses the enzymatic nitric oxide production that declines with age. Your endothelium produces nitric oxide through an enzyme called endothelial nitric oxide synthase. This enzyme becomes less efficient as you age, producing less nitric oxide in response to signals. The dietary nitrate pathway operates independently of this enzyme. Even if your endothelial production has declined, consuming dietary nitrates provides raw material for nitric oxide production through an alternative route. You're supplementing what your body can no longer produce adequately on its own. Research on beetroot and blood flow has demonstrated measurable effects. Blood pressure decreases after beetroot consumption because vessels relax and dilate. Exercise tolerance improves because muscles receive more oxygen. Blood flow to various tissues increases because resistance in the vascular system decreases. These are not subtle effects visible only in laboratory measurements. They are functional improvements that affect real-world performance. The relevance to erectile function follows directly from this vascular support. The vessels serving the penis require nitric oxide to dilate. Beetroot consumption increases nitric oxide availability. The logical consequence, and what research suggests occurs, is improved blood flow to genital tissues. The mechanism is not mysterious or speculative. It is the straightforward application of vascular physiology to a specific vascular organ. Beyond nitrates, beetroot contains other compounds that support vascular health. Betalains, the pigments that give beets their deep red colour, have antioxidant and anti-inflammatory properties. They help protect blood vessels from the oxidative damage that accumulates with age. Betaine, another compound present in beetroot, supports cardiovascular health through effects on homocysteine metabolism. The fibre in beetroot supports gut health and the bacterial populations that contribute to nitrate conversion. The whole food provides a complex of supportive compounds working together in ways that isolated supplements cannot replicate. The anti-inflammatory effects deserve particular attention because inflammation plays a central role in erectile dysfunction, especially after the age of 60. Chronic low-grade inflammation damages the endothelium, impairs nitric oxide production, promotes arterial stiffness, and generally undermines vascular function at every level. The inflammatory burden that accompanies aging is a major contributor to the sexual decline that many men experience. Reducing this inflammation through dietary choices, including regular beetroot consumption, addresses one of the root causes of dysfunction, rather than merely treating symptoms. How you consume beetroot matters for maximizing its benefits. The timing affects how efficiently your body converts nitrates to nitric oxide. Morning consumption tends to work well because stomach acid levels and bacterial populations are favourable for the conversion process. Consuming beetroot earlier in the day allows the nitric oxide effects to build throughout the hours when you're active. The form of beetroot offers flexibility. Whole beetroot, whether roasted, steamed or raw, provides the full spectrum of beneficial compounds along with fibre that supports sustained absorption. Beetroot juice concentrates the nitrates in a more rapidly absorbed form, which can be advantageous for acute effects but may be too intense for some people, particularly those with low blood pressure or sensitive digestive systems. Pickled beets retain some benefits, though the processing may reduce certain compounds. The key is finding a form you will actually consume consistently. Consistency matters more than quantity. You do not need to consume massive amounts of beetroot to achieve benefits. A small serving daily or every other day, maintained over weeks and months, produces better results than occasional large amounts followed by nothing. The vascular improvements build gradually as the supportive compounds work continuously on your vessels. This is not a treatment you take when you anticipate needing function. This is a dietary practice that maintains the infrastructure function requires. I want to be clear about what beetroot does and does not do. Beetroot is not a stimulant. It does not produce erections on command. It does not override your nervous system or create arousal where arousal does not exist. What it does is support the vascular pathways that allow natural function to occur. It helps restore the capacity that has declined. Over time, with consistent consumption, men often find that their function improves because the underlying infrastructure has been strengthened. This distinction matters because expectations shape experience. If you eat beetroot expecting immediate drug-like effects, you will be disappointed. The effects are physiological and gradual, but if you understand that you are supporting vascular health, that you are addressing the actual mechanism that has been failing, that improvement occurs over weeks of consistent practice, then the results can be meaningful. Firmness improves, duration improves, confidence improves, not because beetroot is magic, but because circulation is genuinely better. The advantages of whole food over isolated supplements extend to this domain as well. You can purchase nitrate supplements, nitric oxide boosters, beetroot extract capsules. These may have their place, but whole food provides something supplements cannot replicate. The compounds in whole beetroot exist in balanced proportions, developed over millennia of plant evolution. The antioxidants accompany the nitrates, the fibre moderates absorption. The complex matrix of nutrients works synergistically in ways that isolated compounds do not. Older adults in particular benefit from this whole food approach, because they are often more sensitive to the imbalances that isolated compounds can create. A young person might tolerate a concentrated nitrate supplement without issue. An older person with multiple health considerations, potentially taking various medications, benefits from the gentler, more balanced effects of whole food. The beetroot root will not produce the kind of dramatic swings that aggressive supplementation might. The benefits of improved circulation extend beyond sexual function into domains that significantly affect quality of life. Blood flow to the brain matters for cognitive function, and beetroot consumption has been associated with improved cerebral blood flow in research studies. The same nervous system that sends arousal signals to the genitals operates throughout the body, and improved blood flow supports nerve function everywhere. Mental clarity, mood, and the neurological components of arousal all benefit when circulation to the brain is optimal. Heart health improves when blood vessels function better, which is unsurprising given that the mechanisms are identical. The blood pressure reduction that accompanies beetroot consumption reduces strain on the heart and vessel walls. The anti-inflammatory effects protect against the cardiovascular diseases that threaten men as they age. Supporting sexual function and supporting cardiac function are not separate goals. They are the same goal addressed through the same vascular improvements. Energy levels often improve as tissue oxygenation increases, muscles receive more oxygen, exercise becomes easier, fatigue becomes less pronounced. These effects may not seem directly related to sexual function, but they matter for it nonetheless. A man with more energy, with greater physical capacity, with improved confidence in his body's abilities, brings a different quality of presence to intimate situations than a man who feels depleted and limited. Lifestyle factors significantly affect how well beetroot and other vascular supports work. Smoking damages blood vessels through mechanisms that oppose everything beetroot is trying to accomplish. Continuing to smoke while consuming beetroot is like pressing the accelerator and brake simultaneously. The conflict limits what either input can achieve. If you smoke and want to improve vascular function, stopping smoking will do more than any dietary intervention could do alone. Alcohol in excess impairs vascular function and nerve signaling. Moderate consumption may be compatible with healthy function, but heavy drinking works against circulation in multiple ways. It increases inflammation. It damages liver function, which affects hormone metabolism. It impairs the nerve signaling that arousal requires. A pattern of excess alcohol consumption undermines the vascular improvements that beetroot might otherwise support. Late-night heavy meals divert blood to the digestive system precisely when you might want it available elsewhere. The timing and size of meals affect how blood is distributed throughout the body. If anticipating intimacy, lighter eating in the hours before allows circulation to serve other purposes. This is a practical consideration that becomes more important as vascular capacity declines with age. When capacity was abundant, timing mattered less. When capacity has diminished, strategic choices about meals and timing can make meaningful differences. Physical activity synergizes with dietary nitrates in supporting vascular function. Exercise stimulates nitric oxide production through pathways that complement the dietary nitrate pathway. It improves endothelial function independently of diet. It reduces inflammation. It supports cardiovascular health globally. Combining regular physical activity with beetroot consumption produces better results than either alone because the interventions work through complementary mechanisms. The pelvic region benefits from improved circulation in ways that extend beyond sexual function to urinary health and prostate comfort. The prostate receives blood through the same vascular system that serves the penis. Improved circulation to the pelvic region supports tissue oxygenation throughout the area. Men often report improvements in urinary flow and comfort as pelvic blood supply improves. These are not typically the primary goals when addressing sexual function, but they are welcome side benefits that improve quality of life more broadly. Safety considerations for beetroot are minimal for most people. It is a food that humans have consumed safely for thousands of years. It does not interact problematically with most medications. It does not produce dangerous spikes in anything. The main consideration involves men taking nitrate medications for cardiac conditions. These medications, such as nitroglycerin, work through similar pathways to dietary nitrates. Combining concentrated beetroot juice with nitrate medications could potentially produce excessive blood pressure reduction. Men on such medications should discuss beetroot consumption with their physicians to ensure safety. Men with very low blood pressure might experience too much additional reduction from concentrated beetroot juice. For these individuals, whole beetroot consumed in moderate amounts is likely better tolerated than concentrated juice. The effects are gentler and more sustained, allowing the body to adjust without dramatic swings. I should note that sudden or painful erectile problems accompanied by other concerning symptoms require medical evaluation. Erectile function that changes abruptly rather than gradually, that is accompanied by pain, that coincides with chest discomfort or other symptoms, needs professional assessment. Beetroot is not a substitute for medical care when medical care is indicated. It is a supportive dietary practice for the gradual decline that accompanies normal aging, not a treatment for acute medical problems. The strategic approach to aging that beetroot represents involves accepting that the body changes while refusing to accept that change means inevitable loss of function. Aging does not eliminate erectile capacity, but it reduces the margin for error. When you were young, your vascular system had enormous reserve capacity. It could tolerate insults like poor diet, inactivity, and stress while still performing adequately. As you age, the reserve depletes. The system becomes more sensitive to insults and more dependent on support. This is why lifestyle factors that might not have mattered in your 30s matter enormously in your 60s. The margin is gone. Every input counts. Every dietary choice either supports or undermines the function you're trying to maintain. This is not a reason for despair, it is a reason for strategic action. The same sensitivity that makes you vulnerable to decline makes you responsive to positive interventions. Support your vascular system and it responds. Neglect it and it falters. The choice is yours. Beetroot represents one element in a broader strategy of vascular support. It is not the only element. It works best in combination with other supportive practices: adequate sleep, stress management, regular physical activity, overall dietary quality, appropriate medical care when needed. But among the dietary interventions available, beetroot stands out for the directness and specificity of its effects on the nitric oxide pathway that erectile function requires. The research base supporting beetroot's effects on blood pressure and exercise performance is substantial and well established. The extension to erectile function, while less extensively studied directly, follows logically from the mechanisms involved. Blood vessels throughout the body respond to nitric oxide. The vessels serving the penis are no exception. Supporting nitric oxide production through dietary nitrates supports function throughout the vascular system, including the specific function that concerns men seeking to maintain their sexual health. This approach offers something that pharmaceutical interventions cannot: genuine improvement in underlying function rather than temporary amplification of whatever function remains. Medications have their place. They can be valuable tools when needed, but they work with whatever vascular capacity exists, and if that capacity continues declining, their effectiveness diminishes over time. Dietary and lifestyle approaches that actually improve vascular health address the decline itself. They build capacity rather than borrowing against it. The psychological dimension of this approach matters as well. Many men feel helpless in the face of sexual decline. They do not know what to do. They feel that their options are limited to medication or acceptance. Learning that dietary choices can meaningfully affect function restores a sense of agency. You're not passive in the face of decline. You have tools. You have actions you can take. This agency itself affects confidence, and confidence affects function through psychological pathways that complement the physiological ones. I encourage you to think about this in terms of infrastructure maintenance. Your vascular system is infrastructure that sexual function depends upon. Like any infrastructure, it requires maintenance to continue performing. Neglecting maintenance leads to deterioration. Providing maintenance sustains function. Beetroot is one form of maintenance, a way of supplying raw materials that your vascular infrastructure requires to operate properly. The commitment required is modest. A serving of beetroot several times per week is not a dramatic lifestyle overhaul. It is a small addition to meals you are already preparing. Roasted beets with dinner, beetroot in a smoothie, pickled beets as a side dish. The preparation is simple, the cost is minimal. The taste, while distinctive, is pleasant once you become accustomed to it. Many people come to enjoy beets and the earthy sweetness they provide. The timeline for results varies. Some men notice improvements within weeks. Others require months of consistent consumption before the effects become apparent. Vascular changes happen gradually as the supportive compounds work continuously on vessel walls and endothelium. Patience is required, but the patience is rewarded with genuine functional improvement rather than the temporary effects that wear off when medications do. Your sexual health is not separate from your cardiovascular health, your metabolic health, your inflammatory status. These are all interconnected aspects of the same physiological system. Addressing one supports the others. The beetroot that improves your erectile function also supports your heart, your brain, your muscles, your energy. You're not taking a narrow intervention for a narrow problem. You're supporting systemic health in a way that manifests across multiple domains. The conversation about male sexual health too often focuses on dysfunction, on failure, on what is going wrong. This framing produces shame and avoidance rather than constructive action. A better framing focuses on support, on what can be done, on the tools available for maintaining function as you age. Beetroot is one such tool, simple and accessible and evidence-based, waiting on grocery store shelves for anyone willing to incorporate it into their diet. You have more control than you may have believed. The decline you've experienced is not fixed and inevitable. The vascular system that has been failing can be supported. The circulation that has diminished can be enhanced. Function that has faltered can be restored, not to what it was at 25, but to better than it has been in recent years. This restoration is available through actions within your power, choices you make about what you eat, how you move, how you live. Beetroot is where many men find it easiest to begin. A single vegetable, consumed regularly, producing measurable effects on the pathways that matter most for their concerns. From there, other improvements become easier. Success builds confidence. Confidence motivates further action. The momentum builds until you are no longer passively experiencing decline, but actively supporting function through intentional choices. Your body still knows how to do what you want it to do. The signals are still there. The desire is still there. What has been missing is adequate circulation, adequate nitric oxide, adequate vascular responsiveness. These can be supported, they can be enhanced. The support is available in a humble root vegetable that has been feeding humans for thousands of years. The next time you walk through the produce section, pick up some beets, roast them for dinner, add them to your meals throughout the week. Do this consistently, week after week, and observe what happens over the coming months. Your vascular system will respond, your circulation will improve, and the function you thought you were losing may return, not as a miracle, but as the natural consequence of finally giving your body what it needs to do, what it already knows how to do. Your blood vessels are waiting for support. Your circulation is waiting for improvement. Your sexual health is waiting for the infrastructure it requires. All of this is within reach, available through one simple food that works through mechanisms science understands and your body responds to. The solution was never complicated. It was just overlooked, dismissed as too simple to matter, while men pursued more dramatic interventions that often disappointed. Simplicity can be powerful. Consistency can be transformative. The compound effects of daily choices accumulate into outcomes you cannot achieve any other way. This is true for diet broadly, and it is specifically true for beetroot and male vascular health. The vegetable that supports your circulation supports everything that circulation makes possible. That includes, prominently and meaningfully, the intimate function that matters so much to how men feel about themselves and their relationships. Consider this an invitation to try something different, something based on understanding rather than desperation, something that builds capacity rather than depleting it, something that addresses root causes rather than masking symptoms. The results will not be immediate, but they will be real. And real improvement, even if gradual, exceeds temporary fixes that leave you dependent on external interventions for the rest of your life. Your body can still perform, it simply needs circulation to do so. Give it the circulation it needs.